So a 62-year-old man with suspected ischemic bowel has following ABGs. So that is pH of 7.25, PaO₂ of 10 kilopascals, PaCO₂ of 2.8 kilopascals, and a bicarbonate of 18, base excess of -8. So whenever you have a scenario of pH, so always try to make a table. So here you will add the pH value, here we will add the carbon dioxide, and here we will add the bicarbonate. So once you have established this table, it is high yield to know the values, because if you do not know the values, you cannot solve this question. So the normal value for the pH is 7.35 to 7.45. The value of carbon dioxide is between 35 to 45 millimeter of mercury, and for bicarbonate we have a value of 22 to 27. Usually there is some thing that is changed, and that is that the value for the carbon dioxide can be given in the form of kilopascals as well. So the value of carbon dioxide in kilopascals will be 4.5 to 6 kilopascals, and the value of oxygen will be around 10 to 14 kilopascals. However, we do not require oxygen value to solve our equation, but it is always good to know these values. Now, once we have learned about these values, we will try to put them. So the pH is 7.25. So it is on the decreasing end. So it will come over here. Now the value for oxygen is 10, which is roughly on the lower border of normal. So we will take it normal. Now the value of carbon dioxide is less. Okay, and whenever it is less, it will come on this side. Now the value for the bicarbonate is also less, so it will come on this side. So it will be an acidosis scenario with respect to metabolic problem. There is some sort of respiratory compensation, but it is uncompensated because the pH has not returned to normal. So let's see what is our answer. So here we have the metabolic acidosis with inadequate respiratory compensation, because pH is still acidotic despite low pressure of the carbon dioxide. So this is just the overview of what we have tried to learn and establish. So normal value of the pH is 7.35 to 7.45, as it was less, so it became acidotic. The oxygen level is normal, which is around 10 to 13.3, or you could establish between 10 to 14 kilopascals. Now carbon dioxide is less, and the normal value is 4.7 to 6, and for that we will consider it a compensatory hyperventilation, but it will be uncompensated because the pH has not yet returned to normal. Then a decrease in the bicarbonate is the classical sign for the primary metabolic acidosis, and you can remember with respect to base excess where it is normally between -2 to +2. So as it is very much less, so it will be metabolic acidosis. Now, why there is inadequate compensation? So the partial pressure of carbon dioxide is reduced, that is through the respiratory compensation is happening, but the pH is still not normal. So that is why we will establish that the compensation is insufficient to restore the pH. That is the inadequate compensation. So pH of less than 7.35 will be acidosis, more will be alkalosis, and a PaCO₂ of less than 4.7 will be because of the respiratory compensation. And what will be the respiratory compensation in metabolic acidosis? That will be hyperventilation. So a decrease in bicarbonate and a decrease in the pH is primary metabolic acidosis. So even if you forget anything what we have learned, and there is a scenario which has a decrease in the pH along with a decrease in the bicarbonate, you should know that this is going to be the metabolic acidosis. Inadequate compensation will be when the pH is still acidotic, or for an alkalosis scenario, if it is not normal, it will be considered inadequate compensation. Now, normally, what happens, again, a key point to remember, that in bowel ischemia, there is lactic acidosis, and that results into severe metabolic acidosis with a high anion gap. So, these are just the principles to give you an overview about the relationship of the metabolic acidosis with specific scenario.